Hey everyone, this is Kieran from MSK Physio. Today's exercise or test is looking at the endurance of our cervical flexors. So that's going to be the muscles at the front of our neck. And what they do is they do that sort of yes motion. They bring the chin down and then they also bend the neck forward, going this way. And so if you've had any neck injury, particularly things with whiplashy type sort of mechanisms like a concussion or a car crash, or you just have general neck pain, then you might find this test really useful and it might inform whether or not you should do some of these exercises to improve your neck endurance. So if you've watched some of our other neck videos, you'll know that it's important to be able to get the full range back into your neck. And that goes for any injury really. You want to try and normalize joint ranges after an injury. Now your normal could be different, right? We're kind of thinking what's the pre-injury state. Once you get to that, pushing further into gaining more range takes a little more time and effort. But if we can jump on getting that range back right after an injury, then you'll typically regain it, in a reasonable amount of time. One of the things that's really affected after neck injuries is we see sort of a loss of strength in the front of the neck. And there's a few muscles that we want to consider there. The ones that are really, really close into the spine, so our longest capitis and longest colli. Capitis being capped for like the head, so it acts on the head, it nods the chin down by attaching to the bottom of the skull. And then also the longest colli, which goes down into I think about T3. And so what that means is it goes down the front of our spine and it allows us to come all the way down here. Now, it's not to say that endurance is necessarily strongly correlated with full range, but we need that foundation, particularly around mid-range, to then be able to move on from that and try and get towards those outer ranges. So a full range test would be like if I go down in a relaxed way, can my chin touch my chest? Not an active pull down, so like this. And I can't get my finger in there. And for a lot of people after their neck injuries, they might have 4 finger gaps, 3, 2, 1. It doesn't really matter where, it's just something that tells us there's a loss of range. And so that first step is going to be testing some of their neck endurance and making sure that they can meet some certain baselines. And through some of the research, particularly around postural neck pain, whatever that means these days, we know that 45 seconds is a good number to try and aim for. So we're going to be running through the test, pretty straightforward. And then based on that test, we'll talk about how you prescribe your exercises. And then, this idea between we need to do some endurance training, but also we need to do some sort of peak strength training. So laying down on your back, and it's very straightforward, but it might feel very tough for you to do if this thing is relevant, but you won't know till you try, right? So first, you're going to try and tuck your chin down in whatever range you have capable. So if I put my hand underneath my chin here, I want to try and squish my finger into my neck, like that, okay? Then I want to lift my head just off the ground and hold. So there's enough space that I can slide my hand under my head here, and I'm just going to stay here and hold. And there's other nuances about this. You might be like, wow, it lasted 45 seconds, but did you also breathe comfortably? Could you talk? Talking's a good indication of sort of intensity levels. If you can't talk, then you're bracing with a lot of your breathing muscles, and those breathing muscles are sort of, at least particularly with the inspiration muscles, some of those are actually neck muscles, so they might be preoccupied with bracing. So you're looking to make sure there's a sense of ease to it as well. Your ribs may be reasonably relaxed, you're not sort of hiking up this way. But at the base level, can you be up here and hold for 45 seconds? And you're going to start to feel some fatigue in the front of the neck. And you just hold, hold, hold. Try to keep that chin tucked, don't let it spill out this way. And you just hold like this, okay? Over time, you can pick up the details about it, like we talked some of the bracing maybe, or maybe some of the deep, longest muscles like we talked about, or these SCMs, these big, thick guys on the front. But typically you'll find that as your endurance and strength improves, the muscles on the outside will soften and they won't have to help as much because the muscles deep inside are now strong enough and capable of sort of, controlling or fine-tuning that neck movement. because like that SCM doesn't actually attach to the neck. And if you're interested more in some of the SCM stuff, that sternocleidomastoid, this big guy here, then we've got some videos you can watch on that. So I've just held my neck up, didn't really count. I just went down when I started to feel a little bit tired. But you would go until there's a sense of failure, right? You want to get the endurance of those muscles tested. Now, how do you prescribe? So the prescription is, I wouldn't say there's like any hard research or consensus would probably be a better way to phrase that. There isn't necessarily consensus on how to train it. But if we look at general training principles, you're going to probably want to stay around 60% of your rep max to start with. And there might be a range there. Maybe you go 50 to 70, somewhere in there. So say you lasted 30 seconds. I might then tell you to go maybe between 15 to sort of 18 seconds, or maybe like 13 to 18, somewhere in there. And you can do that for sets. So you maybe hold for 15 seconds, and then you rest for probably double, 30 seconds, go again, hold for 15 seconds, rest for 30 seconds, and do 3 to 5 sets of that. If you have a really fresh, acute, grumpy neck, do less or more treads on like the 50% max, and probably have some longer rest periods. And over time, you can build up that work capacity. Knowing that sometimes pain and stiffness are symptoms of a lack of capacity, and it's your alarm system just saying, hey, I'm not ready. Pain doesn't always mean a bad thing. It's more of like a, hey, watch out, this is an alarm. And so if you're well past those healing stages and you've been given the green light, you're safe to do exercise, then we know that actually that pain isn't as important to prioritize, would be the way I'd phrase it. Still listen to it, still relevant, but it wouldn't be your top priority. So very simple test, then you can prescribe, get yourself up to 45 seconds, and once you can do that, then start exploring other ranges. And we've got some other exercises to give you some ideas on how to do that. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here. And to check out our latest video, click up here.